The Ultimate Nurse's Quick Guide, Medical Billing and Revenue Cycle. From Clinical Care to Claims, Coding, and Remote Opportunities. By Mary Jane Millionaire, RN. What happens after a nurse provides care and documents it in the patient's chart? The story doesn't end there. That documentation can become part of a much larger process involving coding, claims, insurance, reimbursement, denials, and appeals. This is the world of the medical billing and revenue cycle. And for nurses, understanding this system can open an entirely different way of looking at the healthcare profession. The Ultimate Nurse's Quick Guide, Medical Billing and Revenue Cycle was created to help nurses understand that connection, from clinical care to claims, coding, reimbursement, and potential opportunities beyond the bedside. At its core, the revenue cycle follows a simple path. It begins with patient registration and insurance verification. Then comes the clinical encounter, where documentation and charge capture take place. After that, the information moves into coding and claim submission. The payer reviews the claim and determines payment, denial, or patient responsibility. And when something goes wrong, the process continues through denial management, corrections, and appeals. For nurses, one stage is particularly important: documentation. A nurse may think of documentation primarily as a clinical and legal responsibility. But documentation also provides the foundation for coding and reimbursement. A missing detail, an incomplete note, or a vague description of the patient's condition can make it difficult to accurately represent the care that was provided. That is why the guide emphasizes 3 qualities of nursing documentation: accuracy, completeness, and timeliness. Consider a simple example. A nurse provides IV therapy, but the documentation doesn't include the start time, end time, duration, or the patient's response. The treatment happened, but the record doesn't fully capture it. That gap can affect coding, delay a claim, or contribute to a denial. In another example from the guide, a patient with pneumonia remains hospitalized for several days. A note that simply says, "Patient stable, continue treatment," doesn't provide enough updated clinical indicators to justify continued hospitalization. When the documentation instead includes objective findings such as persistent fever, elevated white blood cell count, IV antibiotics, oxygen support, and the patient's condition in relation to discharge readiness, the clinical necessity of continued care becomes much clearer. This is where nursing knowledge becomes especially valuable. Because nurses already understand patient assessment, clinical progression, treatment response, and the significance of objective findings. The guide also introduces the relationship between diagnosis coding and procedure coding. In simple terms, diagnosis coding communicates why the patient was treated, while procedure coding communicates what was done. You don't need to memorize every code to understand the fundamental relationship between clinical documentation and billing. The book then moves beyond the mechanics of billing and explores what this knowledge can mean for a nurse's career. Moving from bedside nursing into medical billing or revenue cycle work is presented not as starting over, but as translating skills you already have. Clinical judgment can support medical necessity review. Documentation skills can support coding, reimbursement, audits, and appeals. Attention to detail can help identify problems that lead to claim denials. And communication skills can help nurses work between providers, billing teams, and insurance payers. The guide explores several possible roles, including medical biller, claims analyst, utilization review nurse, and prior authorization specialist. Each role uses nursing knowledge differently. A medical biller focuses on claims and reimbursement. A claims analyst investigates errors, discrepancies, and denials. A utilization review nurse evaluates whether services are medically necessary and appropriate. And a prior authorization specialist works to secure approval before certain services are provided. For nurses interested in remote work, the guide also discusses the realities of working with US-based healthcare clients, including electronic health records, secure connections, communication tools, payer requirements, and performance measures such as accuracy, turnaround time, denial rate, and first pass resolution. And perhaps one of the most practical parts of the guide is its focus on preventing denials. Common causes include eligibility problems, missing documentation, incorrect or nonspecific coding, and lack of required authorization. These problems may occur at different points in the revenue cycle, but nurses can influence several of them, especially through accurate clinical documentation. The guide ends with a practical mastery checklist. Can you explain the revenue cycle? Can you distinguish diagnosis coding from procedure coding? Can you identify common causes of denials? Can you recognize where nurses affect billing? And are you ready to explore entry-level opportunities in the field? These questions help turn the concepts in the book into something you can actually apply. Medical billing and revenue cycle may seem far removed from nursing at first. But look closer, and the connection becomes clear. Your clinical judgment matters. Your documentation matters. Your attention to detail matters. And the knowledge you gained as a nurse doesn't become useless when you step away from the bedside. It can become the foundation for something new. You are not necessarily starting over. You may simply be building forward. This has been an overview of the book The Ultimate Nurse's Quick Guide, Medical Billing and Revenue Cycle, From Clinical Care to Claims, Coding, and Remote Opportunities, by Mary Jane Millionaire, RN. If you're a nurse exploring medical billing, revenue cycle management, utilization review, prior authorization, claims, or remote healthcare opportunities, this guide is designed to help you understand the system and recognize where your nursing skills fit within it. The Ultimate Nurse's Quick Guide, Medical Billing and Revenue Cycle. Your clinical knowledge has value beyond the bedside.